The health maintenance function in waiting room solutions allows you to input clinical practice guidelines, create patient lists based on clinical indices, notify patients when they are due for tests or procedures, and document and manage these interactions. Among the indices used to run the health maintenance reminders can be created based on patients' age, sex, medications, allergies, diagnoses, tests performed, test results, and vital signs. This solution can be used to run recall reminders, report on patient populations, remind the provider during the encounter of important tests, and automate communications with patients through emails, postcards, and phone reminders. Let's take a look at the tool we use to set up these alerts and lists. Here's an example of a reminder for the MMR vaccine first dose. And here's the rule details. Let's take a look at the DTaP reminder and IPV reminder. Now let's create a rule to see how easy it is to create and run a common health maintenance reminder. In this case, age is a criterion. This rule applies to both sexes. Now, based upon the CPT code selected, if the patient has not had the selected test in the given time period, they will be queued for an alert. In this case, I'll select all colonoscopy procedures. If the guidelines call for the test to be done yearly, I'll enter 1 year as the interval. Now I will set this up to be alerted 2 months before the 1-year time period. Here I'll enter the reminder text, which will go out in a reminder email, or it can be delivered as an automated phone message. Now I'll open the created colonoscopy screening rule. And here are the rule details. Now let's take a look at how these rules are used in practice. I'll check the patient in for a visit encounter. The next step in the workflow is to move the patient to the exam room. During this step, we see an alert page pop up with the tests that are due for this patient. I'll take action on the first test, the hemoglobin A1C for diabetes. Now I'll order the test right from this alert screen. We'll run it for pediatric patient Joe Smith. This alert can also be run ad hoc, that is outside of the normal encounter workflow. This alert shows that he is due for his Tdap and varicella vaccines. These can be ordered and queued for follow-up. Another way these alerts can be used is to obtain a list of patients that are overdue for their tests or procedures, or who simply fit within a criterion that's being queued. Let's look for the patients due for their annual PSA check. The list of patients is produced and can then be acted upon. Notification actions can then take place. Run the colonoscopy screening rule that we created at the beginning of this demonstration. Details. The list appears with patients due for a can then be notified by any of the several optional media, including email. The Health Maintenance Alerts with the Waiting Room Solutions system allows you to create patient lists, notify patients, and automatically be alerted when patients are due for follow-up tests.